Hello and welcome to Fixing South Sudan, your ideas for building the new nation. I am Adingor. Welcome to Fixing South Sudan, your ideas for building the new nation. I am Adingor. This week on Fixing South Sudan, a special coverage about the coronavirus pandemic that is wreaking havoc the world. What preparations are underway in the Republic of South Sudan? Is South Sudan ready? From the airport here, right to the health centers, to the quarantine centers, what is South Sudan doing? We speak to various officials about the level of preparedness to combat this pandemic that is being talked about in the region, in Africa, and the world. Right now, there is the emergency, even they speak of it as a pandemic. It's called coronavirus. It's everywhere and everyone is nervous. Is South Sudan is prepared, or what are the preparations that you are going through?
Thank you very much. The coronavirus, yes, it has been declared as a pandemic. Before reaching the level of pandemic, it was declared as a public health emergency of international concern on 30th of January by the Director General of WHO. So the virus actually started in China in December 2019, and the cases started increasing in 2020. And South Sudan, since the detection of the first case in China, got the information, and we start our preparedness level. For the level of preparedness, the first step that we took is creating a coordination center and coordination structure to coordinate all the information and resources regarding the coronavirus outbreak and other public health events. So the coordination aspect of coronavirus was preceded actually with the coordination structure of the Ebola outbreak that took place in Democratic Republic of Congo. So there was some level of preparedness that put in place for Ebola, and when we now have the coronavirus, same structure also as being used to coordinate the coronavirus pandemic.
Let's talk about the structure of the coordination. What does it involve? Who are the partners?
Well, the coordination structure, this center where we are is called Public Health Emergency Operations Center. And the role of this center is to be a hub of coordinating all the information and the resources. The first thing that has been put in place is establishing what is called the incident management system. So when we have a public health incident, we have to appoint an incident manager, someone to be in charge of that incident. All the information, all the resources that is needed, that person is the one in charge. So this structure has been put in place. Since we don't have a case now in South Sudan, is leading the preparedness efforts. And if, God forbid, we have a case in South Sudan, the preparedness effort will be transferred into the response effort. So the coordination structure is being led by the Minister of Health with the membership of World Health Organization in the country, the Center for Disease Control and Prevention of the US, and other partners that are working in the health sector in South Sudan. So every Monday we have a coordination meeting here in this center to see what are the latest globally and regionally. How many countries are being affected, what are the cases, and what are we doing in our point of interest, like Juba International Airport, how many people came from abroad in the area that are affected.
So at the coordination level, you're doing very well, and suppose that there is a case coming through from the airport, what challenge would it throw at you, and how prepared are you for that? Yes, you have people, so you just walk us through the step-by-step process in case there's a positive case.
Thank you. So the potential source of transmission might be the Juba International Airport. This is where we are putting our much concentration to look at. That doesn't mean also we are neglecting the other areas. So the first thing that has been put in place in the airport, when the passengers came, they go through the screening process. So that screening process is taking place in the airport. You fill the form, you tell the country that you have visited in the last 21 days, and the signs and symptoms. If you have, for example, fever, you have headache, sore throat, or something like that, you have to disclose all this information. So after you fill that form, you now go through the screening. They check the temperature, and if your temperature is 38 degrees and above, we have a holding site in the airport, holding center which can accommodate two people. So you are being held there for a while, and you undergo what is called the secondary screening at the airport. So if the situation persists, for example, the temperature is still getting up, the screening team at the airport will call this center. Okay, they will call the call center, and immediately when we receive the information from the call center here, we have to mobilize the rapid response team. So we have the rapid response team that can be mobilized within 2 hours, and when they are mobilized, they have to know which condition they are dealing with. We have what is called the case definition. So
let's break that one down. Let's start with the call center. How does it work? What is the emergency number, and what kind of information should be provided?
Well, the call center is a station here in the Emergency Operations Center, and the number is 6666, which is 6 4 times. Is Zain and MTN, both of them. You can call it, you don't need airtime to call that. So when you call, you have to report any public health event that you are experiencing. Now for the case of corona, if somebody have, for example, flu-like symptom, you have runny nose, you have sore throat, you have lethargy or the weakness in the body, and the temperature is high, either the person who is experiencing these signs and symptoms will call that hotline, or the person with him, maybe his neighbor or his relative, will call that number. And when we get this information here, we have to evaluate this information and see if they are matching the case definition. So even though if they are not meeting the case definition, we have to inform the rapid response team to go and verify. So we will not discard it until the team verify the information.
It sounds that you are prepared, there is a step-by-step, but only if the cases are underwhelming. But if it becomes a pandemic to the level of Italy or other places, there is a crisis here. We don't have to underestimate.
Exactly.
That the capacity is there, but it's underwhelming, it's small.
It's true, it's true. Now we are lucky we don't have a case in South Sudan, which is something that we cannot also take it for complacency that this will be the situation. If at all wars come to an war, we have something that we can start with while we need more. For example, the isolation facility that we have, if we have more cases, it will not accommodate...
can only do 24.
Exactly. So it will not accommodate more than that number, which also there is a need, you know. Not only here at the national level, you never know, maybe a case can flare up in the states, okay?
Yes.
So we are also in communication with the state. We send them all the materials, okay? The case definitions, how likely the case is looking, and what are the precautions that can be put in place if at all such a situation. Okay, so at this level, at the Emergency Operations Center here, we are working very closely with the health facilities. It's a plan in the process that all the healthcare workers must be trained on the coronavirus and also other infectious diseases to make sure that if at all, we will not only concentrate on the hospital. So far, for example, we investigated 3 alerts, okay? And the first alert was reported actually in Juba Teaching Hospital. So it was a bit scary. People are scared because the knowledge is very low, but we are working the process to make sure that more training will be carried out. Also at this level, we develop a contingency plan, okay? That contingency plan entails all the resources that we need, the human resources, the financial resources, and the supplies.
Can we conclude that you are prepared, but you need support?
Exactly, that is very true.
And are you fixing South Sudan? Can you fix South Sudan?
We are hopefully to work very closely with Fixing South Sudan program, and we are so ambitious, and we are really pleased to have this ambitious vision of fixing the country.
What will it take for your department to contribute towards fixing South Sudan?
What it will take is the government taking a full leadership and putting more resources in the health sector, because Abuja Declaration recommended 15% of the national budget to be allocated for health. So if we have the needed resources, I believe it will not only fix the health sector, but it will contribute in fixing the overall South Sudan. And if we have a healthy people, we will be having a healthy nation that can do a lot of things.
Thanks for being on the program.
Thank you very much.
Okay.
Thank you very much.
What is the level of South Sudan preparedness on this global pandemic? We are here at the National Laboratory, and we have someone here who can tell us what they do and what are the capacity challenges they are facing. So far, there's no case in the Republic of South Sudan for coronavirus, but how prepared are we in case there is a sample?
This is South Sudan Molecular Virology Lab.
And tell us, what do you do here on day-to-day basis?
Here, our mission it is to test any outbreak or any suspected cases of viruses or any disease in South Sudan. Our role to receive sample from outside Juba and from Juba for suspected cases, if it's EVD or COVID or Corona, to test for viruses and release back that result to EOC or Emergency Operations Center to report to where the sample came to release the information in right time.
How many of you are here, and what are the capacity issues you are facing?
We are here, we are 10 lab personnel has been trained to test this sample. We are divided to two groups. One group can be for duty, another group for duty. We are facing testing during the period from 5 to morning.
For this lab to be prepared for any emergency, health emergency such as coronavirus, what do you think should be in place?
What should be in place? We want to train more lab personnel because if we detect any positive case in South Sudan, the lab should be functioning 24 hours. While we are doing that 24 hours, we need more lab personnel, and we need more logistic to be in the place, so we can manage our crisis if it comes to South Sudan. But hopefully we don't want any problem in South Sudan.
And assuming that there is a crisis in the whole country, 10 people are not enough.
Yeah, 10 people are not enough really. We need more. But you know the budget is limited and resources is limited, and even we have a consultant can train more, but you see there is no budget for that things.
How many, what type of viruses have you dealt with before? How did you, such as Ebola and others, what would you say about your level of experience here with other viruses?
Other viruses, as I told you before, this lab is the first lab in South Sudan. Since South Sudan has been created to test viruses. We are testing Ebola. The experience from last year. No, there is no sample sent it outside for testing, just for quality control or confirmation if we get positive sample here. We are dealing with testing for Ebola, yellow fever, Rift Valley, chikungunya, Zika, and COVID now. Until now, we test 4 samples for flu, which we made joint protocol, which can test flu and COVID in one time, so we can minimize the use of the reagent. As we have only one machine here. If we are testing for flu and we are waiting again to test for COVID, will take time. We need our test to be in 5 hours. So we test 2 of them together. 4 of them was negative, hopefully, and our machine was validated, is working well. Yeah.
You think your lab can fix South Sudan, and for it to fix South Sudan, what is the final thought you will say about how you upgrade this lab to the level of other nations?
This lab need funding, need big funding, not to depend on NGOs only. Need funding from government, and then can be completed from NGOs. This is National Institute. Need funding from government. This gap should be fixed by government, and then we will depend to be complete by others. NGOs can leave anytime, but the country is still here.
My normal duty, I'm overseeing the activities of all the all the laboratories and National Blood Transfusion Service all over the South Sudan.
Now there is a pandemic in form of coronavirus that the world is talking about. It is also in Africa, and everyone is nervous about it. So what can you say about the capacity of your lab? What are the challenges, and how do we ensure that we are prepared in case an emergency of that outlook can come in?
Thank you. Let me say something first about the lab. Lab has been neglected, and many people do not know about the lab itself. Lab is an eye of health system or healthcare services. Is a one who can diagnose, is a one who can also know exactly what is happening in the eye of the medical services, whether it's a medical care or preventive care. Without the lab, the whole system of healthcare will be blind. They will not know anything that is happening in the area of healthcare system.
How big is the lab, and what can you say about the operations of the lab?
This lab was founded in 1974 during Abelaler administration or regional government. And it was inaugurated in 2014. That means if you see that gap, anything concerning the lab is sent out either to the neighboring countries or overseas. And it took long time for us to get the results. And In that time, people can die without knowing the cause what they are dying for. And that's why the lab was when the Minister of Health, the former Minister of Health, Dr. Regaj, when he came, he made sure that he set up or inaugurated this public health laboratory, so that there will be any sample that will be sent out to the neighboring countries. When I was brought here, we came up with a strategy. We call it Emergency Catch-up and Convergence Plan, so that we want to implement what Dr. John Garang said. When we get our independence, we start where other people are. The stage that we are in now, we are in the level of other neighboring countries in the form of the equipments, and we are even better than them, because the equipment that we have, these are the latest versions of the equipment that South Sudan has now.
You have some equipment, but they seems not to be adequate, and I understand that you only have up to 10 trained staff manning the laboratory. Is that concerning?
No, not 10. Let me qualify that. You are talking about one lab, because the lab that you have seen is what we call it molecular virology laboratories. We have two molecular laboratories. One is what you have seen. The other one is up here. And the third one, which is we are waiting for, is what we got 2 years ago when I went to East Africa. I found they were dividing the laboratories, mobile laboratory service, which is level 3 and 4.
Talk about your preparedness.
Corona.
In case Corona comes to the country, God forbid, but it's a pandemic that is wreaking havoc in the world, and what are you preparing for in case it comes?
You know, in the laboratory, all over the world are connected, the laboratories. We have a network. In East Africa, there is a East African Public Health Laboratory Network. If there is any deficiency in one country, then also can be covered. In South Sudan, the lab, our job is to detect the disease, then to diagnose. The third is to confirm and monitor the treatment, so that to know the effectiveness of the treatment. This is the function of the lab. Our lab here, as you put it, the virology lab or molecular biology lab, is well prepared. First of all, we train the 10 people that you talk about. And not only the 10, we train also other laboratory with the same level of this molecular biology lab. In the training, our people, they have all the training that they have. And all of them, we have 2 categories. Are master holders and also PhD holders.
You have experts, and
Yes.
they are 10.
Yes.
And in case there is a pandemic in the country, then you will be overwhelmed. So how do we prepare for a situation where many people require attention, and there are many samples that will be dealt with by your lab.
Yes, the equipment that we have can test 90. We have been asking that East Africa that let that mobile laboratory to be brought quickly, so that not only because this is what we have the fixed lab, and if the mobile comes, and we have a lot of areas that are very far, and our infrastructure is very weak, we cannot travel quickly to those areas. We need mobile laboratory so that can be shifted quickly to that.
Would you escalate this issue to the level of emergency, given the rate in which coronavirus is traveling around the region? Would you say that it is absolute emergency to have the mobile lab, not just one, but a few in place as soon as possible?
Yes, the mobile lab, they were donated by Germans. And one time I went when there were Ebola. It was me who suggested to my colleague in East Africa that let us not keep the laboratory in Arusha. Let them distribute it where there is a problems. Recently, the young man who we got downstairs, he was in East Africa and was the one who brought that lab. We still have an issue of that laboratory. We need more training.
Is the mobile lab in the country, or you
No.
are requesting for it to come?
The mobile lab is not in the country, it's in Arusha. In Arusha.
And you have trained the people, you are
We
just
train.
waiting for the mobile
Yes.
lab to be shifted.
Yes, we train all the people in Arusha, in Germany, but we are waiting for the equipment itself to arrive here. But we have an issue, the issue of where to put that equipment. We need a room for that equipment, and we have been campaigning for that.
If you have to speak to the policymakers, which you are presumed to do now, what is the number one thing that the government needs to do immediately?
What I need to them to strengthen the laboratory itself. For Juba is not the only places where our people are. We have 10 states and 3 administrative areas. We need to raise the level of these laboratories so that there will be no sample that will be sent to Juba, and they will take long time for the case to be contained where they are. We need more. We need our government to come up and then put a lot of put some money to strengthen the laboratories in all the 10 states.
What would it take for the government to expedite the shipment or the import of the mobile lab?
The mobile lab, there are some conditions because they said the East African presidents, they want to go to Arusha and inaugurate, which for us as technicians or scientists, we cannot wait for that when there is an emergency. This is emergency. Let us leave the bureaucratic system. Let us also ship the mobile lab to be here so that we can use it if there is any necessity.
And as a matter of clarification, each country is entitled to a mobile laboratory. So it is the lab that is designated for South Sudan that we are speaking about, or is it one for the whole East Africa?
No. The first there were 8 for the East Africa. We were not part of East Africa by then. 2 for Kenya, 2 for Uganda, and 2 for Tanzania. 1 for Rwanda and 1 for Burundi. When the South Sudan requested the East Africa to be a part of that cake, and then 1 was given to South Sudan, they become 9. And 2 in each country, they were sent to Germany and trained there. South Sudan sent 2 as well. And then they sent another team to Arusha for training. And then sent another batch also. These are part of the mobile lab. Mobile lab now is ready. We are ready. We are waiting for the shipment. If they ship it to us here, we can operate the mobile lab normally.
You are telling the policymakers you bypass the bureaucracy, and since there is emergency in place, preposition it immediately.
Yes, if those of Secretariat in East Africa, if they could listen to what I'm asking, humble request, they should send it to us immediately so that we can use it.
Can you also address the question of supplies for your lab? Because I understand that everything is being imported, and maybe what kind of capacity you have, how much supplies do you have, and how much do you need? And if there is a pandemic, do you have enough?
The supply is not enough. We'll talk with 2 parts of supplies: the reagents and consumable. And then also we can add PPE, personal protective equipment. For the reagents, we have now we can test only 300 people. We got some from WHO, Geneva, and some was brought from South Africa, sent by African CDC. It was last week when Undersecretary called me. He was meeting Chinese. The Chinese, they went and offered to us 500. As you are talking about pan-epidemic, that quantity is not enough for South Sudan. We need more. We need more reagents. And also, we need more equipments, because we have only 1 PCR.
More personnel?
We need more personnel as well.
An area to operate in?
Yes, we need all this.
And what about the logistics?
PPE also we need it. But moreover, there's nothing that you can do without financial support. I have a lot of issues here. When there is a sample, and then I used to call people from Godella, from where to come. Then I was faced with, we need a car. These are logistics that you talk about. Or I can use border and then later you pay.
Fund it.
Yes, you refunded it. But this is the bigger issues that I'm facing.
So this place is actually in crisis if there is a pandemic, and you are saying if this is not done, South Sudan is not prepared.
In the term of preparations, we are fully prepared, we can detect. But in the term of other logistical part of it, that's where we can say yes, we have some challenges. South Sudan is better than other countries in the region. We are better prepared, to me. But the number that we have, because if you see in the map, we are put as a country that well prepared, especially for the laboratory. But I have a problems because it's not a public health laboratory testing only. Because when we have a case, if we detect, because there will be a suspect, if it is confirmed, that means we need to quarantine the case. We are going to the different level. We need another lab where we put the patients so that to monitor that patients. And that lab is not there yet.
In this program, we
Yes.
speak of fixing South Sudan. How can your department fix South Sudan?
Yes, what we need linkages. You cannot do one part and leave now. If this finger of mine, if you cut it, the whole body will be in pain. If I detected the case today and there is nowhere to treat that patient or to support that patient, for the detection that I made here will be nothing. And the most important part, it is to contain the spread of the virus. You detect and then you quarantine so that the preventive measures like infection control can be done to contain the spread of the diseases. If those linkages are not there, we are going to be in trouble.
Thank you very much for being in the program.
Okay, thanks.
We are here at the Juba Infectious Disease Unit, a unit which is designed to deal with all infectious disease, highly infectious disease like corona, like Ebola. So this center was established in 2018, end of 2018, when Ebola outbreak was going on in DRC. So the government of South Sudan thought that it was very important to set up a structure that can deal with any case of Ebola outbreak if it's important from DRC. So from that period to now, we are establishing this here to ensure that we safely isolate all infectious disease patients, including Ebola and Corona. Now that the news is more about Corona, this center has been shifted from Ebola to Corona. But as I said before, it's for the whole infectious disease.
And tell us about the center, how it works, what we're supposed to see when we move around. What are the various units?
So this is a center which is designed in a very sophisticated way, especially the way of flow of patient and clinician. It's a 24-bed capacity center. We will go around for you to see how it's designed. So when we enter the center, we go only one way. And if we enter, no one is allowed to go back because it's designed in a way to prevent the infection to spread from community, from health workers. You know, the infection that enters here stops here. So that's the purpose of this.
What has been your experience since the center was established? Have you seen any cases? What can you say about what you have been doing day to day?
Yes, we've been admitting some suspected case. First, there was suspected case of Ebola. All of them were tested negative and discharged. We've also received some suspected case of Corona, one only, and we treated him here. The test was done in our laboratory, national laboratory. It was negative. Meanwhile, our staff pass all the day doing trainings, drills, getting ready on how to put on their combination, how to remove them, how to take care of patients. So the whole day is always busy making sure that all the staff are well prepared to deal with any infectious disease that may come in.
What is the typical process that you go through when you have a case? How do you get in contact with that?
Okay, so when the whole story starts when the rapid response team investigate the case. For example, in a community, if someone came from Italy, for example, and present cough or fever, and he goes to a hospital where they suspect that he might have corona, they will call the 6666 four times, and the EOC, the Emergency Operations Center, will send a group of people called the Rapid Response Team. Those team will go and investigate. If they think also that that case is a suspect case of corona, they will call us. They will call me or one of my team members, and we will deploy the ambulance that you see the other side, which will go to the location where the patient is. We will put on our combination to make sure that everybody is protected, and safely place the patient in the ambulance, bring him here. When the patient arrives here, we put him in a triage room. Patient come with the ambulance. Two hygienists that are in full combination. We will show you the combination. I receive the patient from the ambulance here and bring him inside. He also take the weight, you can see it. And once that is done, two clinicians come from this side in full protection to escort the patient for admission. This one is taking X-ray. Two people are putting in this combination to go and receive the patient. So someone has to be there who is not doffing in full PPE, because that thing is stressful. So someone should be in just normal clothes and direct them on how to wear them properly, not leaving any space between
Yes.
that can expose their body.
That's right.
They have to write their names after they put in, because when it's like that, you cannot know who is she
Yes.
or who is he. So you have to write name and put the time where he put on the PP, so that we will know how many times they have to stay there. No one is allowed to stay in that combination beyond 1 hour,
Oh, really?
because it's too hot. And children, this side for male. Because our supposed patient is a male, we will bring him in male suspected.
And do males deal with males and women with women?
No. For treatment is different, but we separate them for admission. We don't mix male patient with female patient. And you will see the distance between the people who are walking is more than 1 meter, so that there is no close contact between the patient. Typically take a patient in, give him a bed. Yes. Give him a bed. So this is a setting, we have 6 beds in each of these, with 1.5 to 2 meter distance between the 2 beds. Slippers, bed sheet, towels, everything including cup is for one patient. Patient who traveled to China and came to South Sudan, and within the 14 days he developed cough and fever. So he went to a hospital here in Juba, and they suspected that he might have corona. So they call our team, the team went there, bring the patient here. We admit the patient in this very room because he was a man. We collected his blood sample, we collected also other sample. They were tested in our laboratory here and they were negative for corona. So when he was here, if I focus only the aspect of here, we give him food, we treated the symptoms that he has, including malaria, because later we find out it was just malaria. We treated for malaria, we treated for other symptoms. And when the laboratory was negative, we discharged him and he went back to the community
During
happy.
the discharge, don't you have to monitor them in case the symptoms come back?
No. If the symptoms come back, definitely he has to come back here. So we repeat the test, but it never happened.
So how do you keep track of anyone who has been here?
So the government has established the public health officers out of this setting that are following any case that is meeting the case definition. Like if they travel to any area where we have confirmed case, there are people who are following those type of person in their home and getting their phone contact so they can call them and monitor them frequently.
So do you have people on duty throughout the night when the
Yes,
patients are
this place is run 24/7. So anytime we have a patient here or anytime there is an alert, we respond quickly and we provide the necessary medical and nutritional support that is required 24/7.
Can you tell us about the supplies that you have and whether they are enough?
We have minimum supplies because this is just preparedness. We have minimum supplies for management of patient up to 100. In country, we have the capacity to manage up to 100 patients. But you have to understand that if one case is confirmed today, everything is changed because the resources will be multiplied by many times. But just for preparedness, it's just to prepare to take care of the first 100 patients. So the technical side, like if I take just the example of Corona, there are technical capacity in country, and training are going on to increase the capacity of more health workers, to make sure a large number of health workers are aware of how to deal with any suspect case of Corona or confirmed. And South Sudanese are on the front line of those technical capacity. We have nurses, doctors, and some are even going outside South Sudan to gain more knowledge and come back to cascade those trainings. So the technical capacity is still on building, but there is at least something that is done currently.
I believe the center opens 24/7.
Yeah.
What about the staff? Are they on site?
They are on site. They are on site. We have accommodation the other side of the building, and they are on site 24/7, including doctors, nurses, hygienists, and even some international staff. That's to provide some guidance in case there is some question to be sort of.
And there is a lot of panic out there with the public. They cannot be sure whether there are cases that are not diagnosed. What message would you tell the public about coronavirus in particular?
So the first thing the public has to avoid is rumors and panic. There are a lot of things that the government, the South Sudan people are doing to ensure that if any case is identified, it's taken care of quickly before it spread all around. So the first thing that we require as health workers is the support of the whole communities. They have to support us by avoiding first spreading rumors. There is now a number that is dedicated, 6666. If someone hears something, a rumor, or has a question, he can always call those numbers and get the information it requires. Because rumors can worsen even something that was to be handled in a matter of a week, can be worsened. So the first thing that we require as health workers is a support from community, just to avoid rumor, to avoid panic. A lot of effort.
Any suspect?
Definitely, anyone you think you suspect, don't go and touch him, but rather you call 666. A team of trained people will go and take care of the patient, bring him here, or if he doesn't meet the requirement, they can just leave him in the community. But the best thing to do is to report any kind of suspect. Yeah. Doffing, meaning where the health workers are removing their combination. After they finish treating the patient, they assume that everything that they wear there is contaminated. So they have to remove them properly by following procedures and making sure that no mistake is done. They are doing that with the support of someone who is not wearing them, who is giving them guidance. We can follow them through and see how they are doing it. Yeah. There is chlorine. Is a strong chemical that kills virus and bacteria. Chlorine 0.5. And then they spray her with chlorine. Okay. So she has to carefully remove, following the required step by step to remove this combination. They call it PPE, personal protective equipment. And at each step, she has to wash her hand with the chemical, the chlorine, and she has to follow the guidance of the person in front of her. although she knows, but she has to follow what is required. And if also the man who is giving the instruction is also wrong, she can also correct. So it has to be at least 3 people seeing how they are removing it to minimize the risk of infection.
And in other countries, it has happened that the health workers themselves become.
Like in DRC,
Does this minimize or does it prevent?
this is minimize. It's minimize. And it's very effective if people are using it properly and following the procedures. It's really effective to make sure our health workers are not infected.
Last one. Wash. Okay. Now you can hold this from the side.
So you see how she's removing it carefully without touching any part of her body. Yeah.
Below your knee. Stand there. Okay. So important. Maneuver. Dance. Step on it. Remove. Hold it properly. Put it in last dustbin. Wash. And just tie. Close your eye. Front. Up. Front. Straight. Up. Dipping it 3 times.
Because it's reusable, she's not putting in the bin, but rather she's putting in a chemical that is here.
Yeah, the incident manager, when we heard the news of outbreak in China, and then spreading to some other nearby countries, it prompted the Minister of Health in South Sudan to have an emergency meeting, calling the partners and the other government institutions to form a task force, and that task force, which was established, we agreed that there must be somebody to coordinate the intervention.
And what were the specific goals of coordination? Who are you coordinating with?
We divided some thematic areas. First, we started with 5. One was surveillance, and then risk communication. These are thematic areas. And then infection prevention control, and then laboratory preparedness, and then care and treatment. These were the areas we have seen that, yes, if we are to have an outbreak, this department or this technical working group will be essential to run a smooth intervention. But with time, we felt that, yes, the thematic areas or the pillars will be increased to 8. So we added more pillars. One of them we separated surveillance and point of entry, we separated them to be 2 entities. Also, we separated the operation and logistics to be standing alone. And this gave us actually 8 pillars. So it is my work as incident manager to coordinate the work of these particular thematic areas or technical working group. The work of incident manager is the situation is abnormal. So the incident manager will be working to see into that abnormality is actually pushed away and we retain normality. So
Let's stop. Let's speak about specifics. Right now, coronavirus has been declared as a pandemic. And where have you started? And for how long have you been in this position since you were appointed?
we are now 2 months. 2 months since I was given this role to play.
And where have you started so far?
We started, I said that, by actually establishing a task force which is having regular meeting on weekly basis. Then we have this technical working group are also continually meeting in the Public Health Emergency Center. And that's what is happening here all the time.
And how worried should people be, and what is the result of those meetings? What have you concluded? For South Sudan to be prepared, totally prepared, what are you coordinating?
We are not working alone. We are working with WHO, AFRO, and the headquarters in Geneva. And also we are working with Africa CDC, headquarters in Addis Ababa. So regularly we are having conferences, video conferences, teleconferences, to update ourselves and to show them whether we have some shortcoming, particularly technical shortcoming, and they have been actually of support to South Sudan. When we started, we had nothing. For instance, when we received the first alert about people who were coming from the areas affected by COVID-19, and we screened them at the airport level, we found that their symptoms are similar to that one of coronavirus. So we immediately mobilized our team to take care of these particular people, and we took samples. These samples were taken to Uganda because we did not have capacity by then. But right now, we have people trained, we have equipment available in South Sudan, in the national laboratory, and we can test whatever suspect case. So confidently we can say, if we have an alert or a case definition is met, somebody will be tested here in South Sudan in Juba, and within 4 to 5 hours, we'll be getting the results.
So what are your expectations? You are assuming that if worst comes to worst, yes, you do have some level of preparation, but prevention is better than cure. So what is being done?
In the area of prevention, as I said, the infection prevention control, we have material and equipment. These material are available. I believe they have shown your team some of the stock we have. We have limitation, and we don't want just to distribute to anybody because we are still at that level. But again, the preparedness we are talking about is mainly communal. In a way, if we have enough messages, airtime and radios and televisions to sensitize the people of South Sudan, then the chances of coronavirus spreading in the country, I believe, will be limited.
And what would be the message you want to pass on this issue of coronavirus? There are a lot of myths, a lot of misconceptions. What should people think about when they hear the word?
Yeah, the people should not depend on what they read or hear from social media. They are only authentic source of information. WHO, worldwide, and in South Sudan, Ministry of Health. Whatever message is coming from the Ministry of Health, these are authentic messages people should be listening to and should adhere to.
There is understanding out there that coronavirus cannot come to South Sudan because it is a hot place, the climate is hot, and therefore coronavirus cannot survive here. It is true?
It's not true, because virus live inside human being or animal. And if human being can come from Europe or Asia to South Sudan, it means it can bring coronavirus to South Sudan. And as we know, the body temperature of human being is the same. Whether you are in Europe or in America or in South Sudan, it's the same body temperature. So it will, if at all somebody brought it, it will spread.
Right now there is an information gap, and your department is supposed to coordinate that the public has the right information. We are talking about who, we are talking about Ministry of Health, and you have the vast majority of population who cannot read and write. So what are we supposed to do in the interim, or what would you recommend so that you are better prepared to prepare?
We recommend a serious sensitization, communication through media, through any other churches or any other gatherings, because right now we are not preventing gatherings, but the right information could be passed there. There are jingles, there are talk shows, all these things. If we have adequate resources, we'll pump the radio station, the television station, the newspapers, it's all the information.
In terms of resources, what kind of resources do you need in place for you to say, yes, we are ready, come what may?
Yeah, as you know, Madingo, Minister of Health not have a radio station or a television channel to pass information. But we use other media houses. And most of these media houses are private. And we need to buy airtime so that we pass a lot of information, authentic information, not any information.
Have you made your assessment, a global assessment about the needs that exist for your department to be fully functional?
Yes, we are having, sometimes we say it is a blessing in disguise because we had Ebola preparedness in place. And right now the cases of Ebola are coming down in DRC. And the last patient was discharged this week actually. So we believe that the equipment or material available, we can use them to combat corona, plus additional resources.
On the money, how much are we talking?
Right now we are talking as a preliminary assessment for preventive aspect. We need not less than $2.5 million US dollars.
And where are the potential sources of funding? Have you got any pledges from donors? And what is the role of the government? Or what should be the role of the government?
Of course, this is a government-led process and exercise. The government should be in the lead. But because these days, of course, our government people are busy politicking, and we have not yet actually, the resources were supposed to be forthcoming. We have not yet received these resources. The same thing with the partners, there are pledges, but as I said earlier, we are using the available resources from Corona from Ebola to Corona to push the process and preparedness level. Earlier, I said that we continually do self-evaluation. When we started, we were at the level of 60%. I believe we are above 70% right now.
Based on the trends that you are seeing, the level of growth of coronavirus in many places, should South Sudan be worried or be complacent about, or keep the status quo?
We shouldn't be complacent, Nadim. We are trying to see that we cope up with all the nations around us. And this is on a daily basis. We are having conferences with the world. We are getting updates. Sometimes we can change definitions. Sometimes guidelines will be updated. So we are not left behind.
Thank you very much.
Thank you.
And with us is Under Secretary, Ministry of Health, Dr. Makur Matul, and he's here to tell us what plans are underway to ensure that coronavirus does not come to the Republic of South Sudan. Is South Sudan prepared? Are you prepared to ensure that you contain coronavirus?
Yes, we are prepared. We have mechanisms in place to ensure that this country is protected and that we do not import cases into the country. At the governance level, we have a high-level committee normally chaired by the minister on behalf of the President of the Republic. And under that high committee operates other technical committees, one being the coronavirus task force, chaired by the Under Secretary, with support of the incident manager who is Dr. Gordon, and our partners, the leading partner being World Health Organization, and other important partners like CDC, United States, the DFID, the UNICEF, all other important donors are part of that, are members of that group. And then under the task force, we have technical working groups, and the technical working groups are specialized. There's one on case management, and there's one that works on detection, testing, and diagnosing, and management of the case. Then the laboratory part of it, then also surveillance and risk communication, which is the part concerned with the public communication, communicating, and health education.
How alarmed should we be about this virus now being called a pandemic? How serious is it?
It is absolutely serious in the sense that it is spreading all over the world around the same time, and that's what qualifies as a pandemic. We have seen similar pandemics in the past, but of course this is the first pandemic due to coronavirus. So given the experience of the past, there's every reason to worry, there's every reason to take precautions and to protect our people. Good, thank God, because this pandemic is happening at the time when the world is well advanced, the health system has developed very well in the world. Our responses are much more better than they were 100 years ago.
And our responses, how much resources are needed or being mobilized?
Resources, of course, have different forms. They present themselves in different forms. We need a human resource, of course, which is adequate, which is skilled, and which also responds well to an emergency. We need, of course, resources in terms of equipment in different places, right from the ports of arrival, where you start the work by screening the arrivals, and if there are suspects, you've got to take them to a laboratory for testing, and if need be, you may have to quarantine and isolate and quarantine them, and if they are confirmed to be sick, then you've got to treat them. So you can see all this requires a lot of resources in different forms, but all at the end of the day, it boils down to money. And on that, of course, our partners are doing a lot to support us. We have established a laboratory for confirmation and diagnosis of cases with support of our partners.
Let me just interrupt you to say that we have gone around the clock, and we know the basic preparation that is in place, and the quarantine center can only do 24 cases at a time.
Yeah.
So there is some preparation, but it is underwhelming. Suppose that you had a pandemic of the proportions that we have seen in other countries. Can we plan for such kind of emergency?
Actually, plans are underway to expand.
And
that,
for those
quarantine
plans
center.
to materialize, money is needed. And when we speak about money, how much is the government putting in, not just the health partners, the UN agencies and the others, but what is the role of the government?
Yeah, we have presented our budget to the government, and we hope the government is working on it, they are responding to it. We met with the Secretary General, we discussed this, and this morning we met His Excellency the President, who brought this to his attention, and the government is giving it its utmost attention to ensure that government invests in this. The preliminary budget that we have presented is about $2.2 million, and of course that is a peanut, and we are working to ensure that at least this covers the first 6 months of our response, and if we realize it, then that will be a good start. They are also in communication with the World Bank as part of their pledge to support countries around the world, and that is being handled at the level of the Ministry of Finance. And so these resources pooled together, in the end of the day, in the end we'll have to ensure that we put them to good use, and that we respond adequately to this emergency.
On this preliminary request, is that to be met solely by the government, or do you require external support?
At the moment, a part of it is taken care of by the partners, But of course, the government is going to invest in that also. But of course, as I said, this is the first 6 months. As the situation evolves, then we'll develop new budgets according to the evolution of the situation.
Is the assumption that when you get this money, it will push you to maximum preparedness? Is that the assumption?
Absolutely, that's the assumption. And the assumption is also that within 6 months, the pandemic might have been controlled. And we may not need additional work to be done. But of course, if needs be, and the pandemic continues to evolve or actually spreads and worsen, then definitely there will be need for more resources. And that's the assurance we got today from the president.
And what is the expenditure going to be like? If in the event that you get the money, what are you hoping to do with it?
As I told you earlier, we have plans in place to expand the isolation center. I think that's very important. It needs to be quickly done because there are a few things here and there that need to be made available in the center. We also need to increase our laboratory capacity. At the moment, we have 300 kits for testing, which means we can only test 300 people, even though we are expecting some other 500 from China in a couple of days. That will make 800. In the event that there's outbreak in the country, God forbid, it's likely that we may run out of those items quickly, and therefore we need to get more of those. That's how we look at increasing our diagnostic capacity, including also the personnel, because we now have 4 laboratory technicians who are trained on this. So we need to increase that numbers. So these are just examples of how we have to use that number.
The intervention that exists is largely in Juba, and Juba is not South Sudan. There are the other states and administrative areas, and there was talk of a mobile lab such that even within Juba, it's not only confined to one area, and that it was a station in Arusha, and the request was that maybe it should be expedited. Is this something on top?
Absolutely. I mean, the plans with the EAC, thank to the Secretary of the East African Community for providing those mobile laboratories. The plan was to have those in April, the latest. But of course, given the development at the moment, there's a discussion that is ongoing to ensure that these are delivered as quickly as possible. And the thing also with the coronavirus is that you may not need really to admit anybody presenting with the coronavirus. Many people, majority actually, most of the people will present with mild symptoms and self-isolation at home and treatment at home. May all that is required to do and the people recover. So the few that will require admission, our current facility can do the job, and if need be, we are expanding, of course, as I said earlier.
The current facility was put in place to deal primarily with Ebola, the threat of Ebola, and is now being converted to handle this possible outbreak of coronavirus. And what I would like to underscore is how the health sector is under the mercy of the donors. And do you find that the government is now understanding that the health sector is not a sector that you only deal with on a piecemeal basis, but something that needs a holistic approach? Do you see government coming in more and more?
Yeah, we see that happening. I mean, it has been a difficult situation over the years. I mean, the best major allocation this ministry got, or health sector generally got it, was in 2006, when the government, the health sector was allocated 8% of government budgetary expenditure per year. That continues to decline over the years until it reached its lowest in the current financial year of we got only 1%, likely to support salaries. But with the coming budgetary season, we've got promises from the Ministry of Finance that they were going to work out the numbers, and they have actually requested us to present our priorities as early as possible so that they can make decisions before actually they could decide on the ceiling for the next budget. So I think that's a recognition of the importance of having to invest in health, because for anybody, for any country to have a strong, growing economy, they also have to have a healthy population that is capable of working and producing.
You have this cultural, you have this approach where when there is an outbreak, you appoint incident managers, and now there is an incident manager for coronavirus. And is there supposed not to be a policy in place where in other countries, public health institute deals with this kind of issues, not on a case by case, but on a holistic basis? And I understand that there was supposed to be a public health institute instituted, and it has not yet happened. What is being done in that front?
We have this public health institute after establishment, and the principal of the public health institute is the Dr. Gordon, who is the current incident manager for coronavirus efforts.
Why is it important?
It is important because it handles all public health issues in the country, and it acts as a think tank and pool the resources together to assist the government in responding to public health issues. So this is a very important institution. Of course, for us it comes as no surprise why we are talking about establishment at the moment, because our systems are new in many countries in Africa who actually have been there before us. They just started recently. So we are not very much behind on this. We are actually working together. There are many other countries, 6 of us in the south and eastern Africa region, who are working on establishing their public health institutes under African auspices of the African Union.
What is delaying the establishment?
Well, the delaying, we are working now on the legal framework, and we know these are procedures. Of course, given the fact that also there are a lot of things happening in our government, it is also expected that some documents may delay going through the legal processes. But of course, the draft bill for the establishment system is already in place. We are discussing it with the African CDC, because African CDC actually is the body tasked by the African Union to help member states on the development of this institution.
There is a lot of panic about coronavirus worldwide, even in countries. Even suppose that suppose that you had the funding you want. Let's look at the level of the United States. They have 1,000 cases, and yet they have not brought it under control. In other countries, this is a national emergency, and there is a complete lockdown in some countries. And they say prevention is better than care. Are you taking any preventative measures?
Absolutely,
or
we are doing that. We have already applied some of those measures, particularly with regard to movement of people from countries and areas that are affected.
Can you elaborate?
Well, with some of those countries, we have imposed visa restrictions, meaning that citizens of those countries or people living in those countries, even if they were South Sudanese and they are planning to come to South Sudan, our advice is that they must not come at this time, and that our embassies should not issue visas, and those who have been issued with visas should have to be revoked and postpone their plans until further notice. We are also advising that people coming to South Sudan from countries that may not be affected should use routes that do not pass through affected countries or areas. And,
are you speaking about government policy or something
you would like to say? That is the policy. And
so which countries?
And that we have done that already.
Which countries?
We are doing this with China, we are doing this with Italy, and we are also taking other measures that will be made public within a short period. And we felt that these are very important, including considering cancellation of some flights coming to the country.
And when we speak about China, the oil industry is entirely manned by China. Will you be able to do without China in the interim?
We are still working with them. We are saying we are using deliberate terms like absolute importance or absolutely essential kind of a thing. For example, if Madingor is a Malaysian, for example, and is an engineer specialized in pipeline repair and got one of the pipelines broken, and Madingor may be allowed to come in under very strict conditions. One is that before arriving here, before leaving Malaysia, for example, they will have to isolate themselves for 2 weeks and also getting tested, then come to South Sudan. While in South Sudan, also on the arrival, they will be screened and also put on self-quarantine for 14 days before they actually go to the place of work or before they engage with the members of the public. So that's how we are doing. So we only allow in on case-by-case basis if what they are coming to do is absolutely essential or important. But nationals, say Chinese for example, who are running a small business in Juba, are not that much essential. If they are now in China, we are telling them, don't come, please wait until say time when the conditions are favorable, then you may come. We are also doing that to South Sudanese. And last week I met with the South Sudanese business community, advising them that they must avoid
The South Sudanese who are supposed to come from China.
Absolutely. Those South Sudanese also have told them, at least for now, better for you to stay in China or any other affected area where you may be. Because coming to the country carries a risk of bringing infection, expose your loved ones to that risk of infection, but also even the fact that our healthcare system is weak. If anything happens to any of our nationals, in those countries they may get better care than they may get here. So that is a reality, and we must take them and we must accept and thank those families, many members of the families who have their loved ones in those countries have heeded to our appeal, and thanks particularly to the government of China because it has given special attention to South Sudanese students. They have given special accommodations, and they also look after them on day-to-day basis. And to date, we don't have any report of any of our nationals having been infected.
Is there some kind of a gap in your ministry?
There's no gap because there's also a vice president tasked with service cluster, including health. And I have been seeing him on a daily basis to update him on the development of the pandemic and also receiving directives from him and share them with colleagues and partners and work on them. Also, we have been in continuous consultation with the Minister for Presidential Affairs. Called us to his office on Tuesday. We met and we discussed issues. And again today, we discussed on other important issues. And that also took us to see the President, who was very keen to know exactly and gave us his directives on what should be the next course of action. And that will be made known to people in the due course.
Is there, as far as the public is concerned, how are they supposed to behave or react? There are a lot of rumors going around. And looking at all the indicators, is it your sense that coronavirus will not come to South Sudan?
I cannot say that. We can only hope that it doesn't come to South Sudan. But of course, we have to put in place measures at personal level, but also at institutional level. At personal level, it is important that we observe things around us. We avoid unnecessary troubles. And if we have symptoms of flu, then we have to isolate ourselves. And if those symptoms wasn't developing into shortness of breath and fever, then we have to seek medical care. Let's try to avoid public gatherings as much as possible. We are advising that events must be well organized if they have to be done anyway. But the best thing always is at this particular time, events that bring a lot of people in one place, it's better that we delay them to some appropriate time.
You are wishing and cancelling that they don't, but so far you don't have restrictions.
At the moment we have not imposed a ban, but we are still trying to educate our people to understand why these said measures are necessary. And that also if we are forced or we think that it is appropriate to impose a ban on some of those activities, then they must understand this is being done for a good reason.
Dr. Marco, thanks for coming on Fixing South Sudan.
Thank you so
Are
much.
you fixing South Sudan?
We have been fixing South Sudan.
And what is the ministry doing to fix South Sudan?
We are building a strong, resilient, and responsive healthcare system.
Thank you very much.